We have an audience of about 34,000 employees.
We have patients that are using applications made on our team, doctors, nurses, and then all the support in between.
We have over 3.5 million monthly users.
There could be anywhere from 12 to 15,000 concurrent users on one of our clinical systems at the same time.
We have over 5,000 individual sites.
We work with a lot of cutting-edge new technologies. It's very exciting work, it's meaningful, people use our tools, they're very engaged with what we're doing.
We create tools that are intuitive, easy to use, fun to use.
And we support the products that we roll out, so if we get feedback from the users, we'll be able to go ahead and implement new changes, add new features.
We try to look ahead and see what kind of tools employees will need, to be more efficient and productive and help them collaborate.
We are very connected to them and we're able to react to their needs as compared to another company where you may not get feedback on the work that you're doing.
At my previous place of employment, we worked on a lot of software applications that became vaporware or put on the shelf and were never actually used. But here we're able to take a product from concept to full-blown production in a matter of weeks or months.
What we look for in candidates is someone that has a passion for technology.
I feel like we hire first for a good fit, and then we hire someone that's sharp.
Somebody that's able to come in and help us solve the next generation of clinical problems. Prospective engineer needs to be aware of how seriously we take patient privacy.
Every developer feels it's their responsibility to keep that data safe and do their part to protect Intermountain and Intermountain's patients.
Healthcare is a different field in that it's nothing like software engineering, and you have to be able to apply the domain expertise of others to your job to be successful. You have to rely on people that have clinical knowledge.
It can be a challenge to bring everyone together at the table and make sure that you're meeting the interests of all your stakeholders, because the company is so large.
When you get stuck with a bug, sometimes you can spend days, and you just have to have the patience to work through it, and you have to be humble and willing to rely on the expertise of others.
So there's this continuing challenge of just keeping our head above water with all the projects we have.
Everything that we do is based on two main databases, and they've been homegrown databases built by Intermountain, but they're outdated now. So they're going through the process of updating these. It's a major change for everybody.
I've stayed with Intermountain because it's a culture where I think every employee's opinion is valued.
The camaraderie here is my favorite part.
And working for a nonprofit versus a for-profit company has been a huge change for me that I really like, and it was something I was looking forward to. I was sick of kind of that red tape.
Where you're developing video games, where you're developing financial software, you're really developing software that's providing people with a better life.
I didn't want to end up in kind of a basement room writing test after test for some financial application. What I wanted to do was make software that had a good purpose. In the end of the day, that kind of makes you feel good about your job. And I think it's a good purpose. It's a good motivation. And that's how I ended up in healthcare.